So first of all, thank you so much for the invitation to speak. I'm so pleased to see a webinar completely focused on PPI. It's really nice to see that. And it's a pleasure to be here and see some familiar faces and some new faces as well. So my name is Mayara, but you can call me May, it's a lot easier. I'm a research officer and I'm also the patient public involvement lead for the Center of Population Health. And today I will be talking about a very specific thing, which is PPI involvement in grant applications, which I know is very specific. So I will explain a bit more what that is. I know most of you will know, but just for the ones that are not used to this language. So as researchers, we always have to apply for funding. And we do that by applying for grants. So there's lots of different funders. And when you're starting a new research, you need to get funding before you start. And that's a whole process, very long, and it's very different depending on the funder. And as part of the center, we wanted our strategy to be guided by what is important for people. So we wanted to get PPI involved right at the beginning. Research grants, when you get your grant, that's the very initial stage in the research cycle. And I'll talk through the research cycle a bit better in the next slides. But why we wanted to do that? Well, the main reason is that we wanted to have what we call prioritization, which is having research to be guided by the needs of people. So not by what is the gaps in the evidence like we used to do in the past. We don't go and look at the gaps in the evidence. We go and look, what are the problems people are having? What can we do to help with our research? So identify those problems and use the research to prioritize those problems. And this is how we do what we call a pathway to impact. When you have your patient and public involvement right at the beginning, that is helping you then to address real problems. And that's what we call pathway to impact. The research will be impactful, will have a real impact and address a real need. And lastly, we wanted to make sure the disseminations we are having in our proposals were actually targeting those communities we want to target. Are they appropriate? So do they go beyond the academic journal dissemination? Can we be creative? Can we be specific for a specific population? So those were the three main aims. We didn't know the kind of worms are opening when we started doing this. There's a lot more that I will talk through, but those are the three things we had in mind at first. So it's been around almost 3 years now doing this work, and I have to say that we're still co-producing this strategy, is always evolving. But the first step was to understand the needs of our members of the public. We started working with around 7 people, understanding their needs. How can we get them to feel comfortable to start giving input and participating in this process of grant writing? It's not an easy thing. Even researchers struggle to do this. It's very complicated. So the first step is to not assume what their training needs are, and is to ask them. And that's something we do along the whole 2 years. We're still doing this. So I will talk through in a bit more details in the next slide. The next thing is to co-develop the workshop format. And I have to say this changed quite a few times, but that's good. We want to keep changing and evolving. And the most important thing that we can do to help evolve those workshops is to continue assessing how those workshops are working for people. So at the end of every workshop, we would assess, you would ask our members to say, how was it? Did you like it? Is anything you could change? It's a very informal process. We just had a quick chat or did it via email. So to understand, is it working for everyone? People have different needs, so you just have to tweak it as we go. And lastly, how is the impact? And the impact here is 3 different ways. How is the impact to our members of the public? Are they learning with it? Are they enjoying it? What is the impact to our researchers? Are they getting what they need? Are they able to, include PPI and the PPI input they're getting in their grant application? And lastly, what is the impact for the whole center? Is it affecting the amount of grants we're getting? Are those research grants being granted? And then what happens next? So those are the main things we kind of worked on. Right, so the first thing after assessing their needs was, everyone had the same question: what is even a grant proposal? What is it? And there's lots of different funders, like I said, and they have different processes, and they usually take a long time. So getting them used to that, the different funders have different requirements. How does that fit within the research cycle? So it was a learning process, and we're still working on that. But I have to say that all of our PPI members, they're very comfortable with this to this day. They developed so much. Digital skills. So we do have a Teams shared folder, shared channel that we use. We don't use it as much now, but I'm sure our members of the team, our PPI members, they're very comfortable using Teams. I would say 90% of our members use Teams to check their files, but that's fine for the ones that are not able to use or share things with them in a different way. So I try to be flexible on how they would like to receive their files. So I'm very flexible with this. Using Word, some of our members didn't know how to use Word, so they wanted to be able to put comments on a Word document. So that's something we worked together to develop. And that was important because they would receive some documents they wanted to be able to make comments on the actual document. So learning about the research cycle was a very important thing. What is a grant? How it affects the whole research cycle? What is the role of a grant application? So that was a very important thing. I'll talk through. We worked with a very simple diagram that I will show you. I find that simplifying things, it can be really helpful. So break step by step, especially when it's a very complex thing, such as a whole grant cycle. And then areas of research, they will be different depending on the areas of research. We are a Center for Population Health. So as you can imagine, there's lots of different areas of research that we're focusing on, from maternal health to, policy data and so many different things. So, and obviously not all of those topics will be relevant to our members of the public. So how do we work around that? So that was also a learning curve for us, and getting used to the different funders. So those were the things that came true. The assessment of training needs that were addressed as we went. So this is the research cycle diagram that I mentioned. As you can see, it's very simple and easy. And the first step, we were stuck for a bit that we kind of figured out later, was that this thing about having an idea and then being able to do your funding bid is not always as straightforward as we think. Sometimes you go for a funding bid that is already there, so you have to respect the remit. So that was something that we had to get used to. There's a kind of limit to how much we can be creative with our research ideas. And then we write your grant application, you apply. Not always you'll get the money, unfortunately. Most often than not, you just have to go back to your initial project idea funding bid. So that means that sometimes we would work with the same researcher for a really long time. They would come back to the workshops 3 or 4 times, which is a good thing. So it means that we manage to work along with them. So we want to go towards the co-production side of things rather than one-off involvement. So how did our PPI work on the grant applications? We worked together, and the first thing, we started quite small. So we will first focus on the things we're most comfortable with, which was looking at the language on our plain English summary. Is it appropriate? Is it focusing on everyone that should be focusing? Is it an inclusive language? What are our dissemination strategy, like I mentioned? Is it, targeting the communities we want to target? Is it appropriate for those communities? And what is our PPI strategy like? Can we expand it? Is it appropriate? Are we actually considering all the stages where we can have our PPI involvement? So those are the 3 things we started working on when we had the grants coming in. And then we started expanding. As they got comfortable, we started looking at other sections. They started asking about the population. Are we involving everyone? Are we being inclusive? Are we being diverse enough? Are we targeting the right populations? What about a research question? Is it, broad enough? Is it relevant? Can we think, is it actually going to solve a real need? What about research methods? Are they appropriate? Are they causing any burden to our participants? Are they actually addressing the research questions? Are there any ethical issue they can think of? And finally, the budget costs, because as PPI members, they know exactly how much it costs for the involvement, and they can really tell if you're under budgeting, which tends to be an issue, to be honest. And we know, depending on the funder, they might not be as accommodating, or they might not, depending on the funder. So that's something we learned. Some funders are very good with this. They understand the PPI, there is a cost, and you need to cost it right to make sure you're able to have your PPI, activities. But that's something that they're really good at helping us with. So you can see we expanded quite a lot on the areas they could be involved. So about the practical aspects of the workshops, this started quite small. I remember first workshop, we only had one researcher coming in, and it was a small workshop. And now we have our workshops from 90 minutes to 2 hours, sometimes a bit longer. So we try to give each researcher 45 minutes at least. So we found this works the best, so people don't feel rushed. They come in, so the researchers come in, talk about their grant idea, some aspects of the proposal, and they will receive feedback from our PPI members. Also, another very important thing is having a PPI member as chair of a workshop, and she's here today, and she's amazing. I cannot praise her enough. She's really good. And I think that's a very key thing, because it helps the other members of the public to feel comfortable, to feel able to voice their opinions, and it really helps a lot. All the relevant materials are sent in advance to our members, and that will vary depending on the researcher, but we always try to ask them to send at least a little summary of, the topic what they're going to be presenting on. If they have any specific questions they want to ask our PPI members, this is really important, because they want to be prepared. They want to be prepared to be able to participate and contribute as they want to. And another very unique thing from these workshops is that it's a mix of researchers and PPI members. I know that's very unique. So all of those workshops are open for the researchers of the center to come in. And we kind of tested this to see how it would work, and we decided that this worked quite well, because as the researchers are attending, they will learn with the input from our PPI members. They learn so much. And I can see how that really helps the way they think about PPI involvement, and they can see the real value on those workshops. And that really shows with our numbers that increased with as the years went. So we started quite small, like I said, one researcher coming, and now we have from 15 to 20 people attending, which is really good. 7 members of the public, and the others are researchers. One of the things that I find really helpful is using a Padlet to keep a record. So this kind of helps us also to prioritize our PPI members' voice. So I always ask the researchers to please put their comments on the Padlet first, to give the floor, if you like, to our PPI members to start giving the input. And this is really helpful, because I also write any comments, any questions, I write it all in the Padlet, and this is sent to the researchers afterwards. So they have a record that they need to focus on making notes. And as also, everyone's got access to the Padlet, and they can just put comments anytime. And the Padlet is open even after the workshop, in case members of the public think about any comments or questions they want to add afterwards, which is very helpful. So what is the impact? So what was the impact of our workshops? Since January 2023, we run 12 workshops in total and discussed 20 grants. 16 of those were approved. I use Spirit to record the impact, so this is a very helpful tool. I just input everything that I recorded from the Padlet and any other impressions or comments that I have on the period. And here are the amounts, as you can see. One of our main goals as well is to increase funding for Wales, and you have the funding separately there for our center. And that's very valuable. It just really shows how our PPI input into grants really helped to up those numbers. We also recently presented a TED Talk at the Health and Care Research Wales conference, which was really fantastic. this was all co-produced with 4 members of the public, and 2 of our brave members were there presenting, and they did such a fantastic job. I just wanted to include their photo there with their permission, just to say that I cannot praise it enough, their involvement and their commitment to this group. And just to finish, I know you're going to have the slides afterwards, so I added some very useful resources and organizations. There are things that we use through all the years, and if you want to have a look at the resources that are out there. And that's it. Thank you so much.